Hello, my name is Christy Sherrill. As a proud Marine Corps veteran, I would like to welcome you to the Rural Veterans Health Access Program training module for understanding the importance of screening patients for military history. This video is intended to inform healthcare providers about the importance of screening all patients for military service history, which gives providers the tools needed to implement comprehensive treatments and support to veterans who come into their care. This video will explore the misconceptions providers hold when considering collecting data on military history of their patients. It will walk viewers through the steps to take when entering data into their health management systems, as well as securing referrals for future integrated care. In this video, we will explore the following objectives. We will recognize the importance of screening all patients to identify or track those who have served in the military. We will identify barriers faced when health providers consider screening patients. We will learn to enter critical data into their health management data systems. We will identify benefits of partnering with the VA when treating all military personnel. And finally, we will look at strategies on how to become more knowledgeable and competent in treating all military personnel. As mentioned in Episode 1, nearly 250,000 service members are discharged from the military each year. With that number of veterans integrating into civilian life, it is likely that healthcare professionals will provide care for a veteran at some point during their professional career. Veterans face complex and often unseen medical and psychosocial challenges. These include cardiovascular disease, cancer, chronic pain, depression, substance or opioid use disorder, and so on. Female veterans face challenges when seeking veteran-specific women's health services, such as maternal health care. Also, as mentioned in Episode 1, it is important to screen each patient to determine if they have served in the military. During the screening process, keep in mind that some veterans may not self-identify or be reluctant to seek help. Reasons why veterans may not self-identify are the belief that any psychological issue is a sign of weakness, or fear that expressing an emotional reaction may be confronted with "get over it" by their veteran peers, or the fear that seeking help or any type of emotional reactions will negatively impact their careers. In addition to veterans possibly not self-identifying, providers may hesitate to align with the VA health system due to misinformation. Providers may be concerned that reimbursement for services may be minimized if the VA becomes involved in treatment or even billing. Well, actually the opposite is true. The newly formed Community Care Network, or CCN, will assist providers in navigating the VA billing procedures, which will be beneficial to all parties involved. The CCN offers additional services that go beyond those offered by the original network PC3, or Patient-Centered Community Care. These expanded services consist of dental, pharmacy, medical equipment, dialysis, home health, and more. It is essential for healthcare administration to gain the total picture before treatment begins. Providing an initial military history assessment for patients is the first step to set up in the screening process at your facility. This will identify those who may be eligible for a variety of veteran services during the patient registration process. Here is an example of how the initial question can be phrased to ensure that all veterans self-identify when asked. Have you ever served in the military in any branch, any length of time, anywhere? The initial question can be asked during the initial intake process for new patients, as well as each time a patient checks in for their appointment. A second questionnaire, which includes more details, will be presented to the patient in the treatment room with the provider. Each medical facility will want to customize this second questionnaire based on their areas of specialty treatment. When meeting with the provider, a variety of wellness questions should also be explored. These questions can flag homelessness, addiction, and employment challenges. The patient's responses will help lead to referrals to mental health specialists and social workers. These areas are sometimes overlooked by healthcare professionals. Once your facility has decided which screening questions you would like to ask your patients, office managers or billing personnel can incorporate these screening questions into the system by placing a request with IT support services within your EHR system. After this request has been completed, you may now begin screening your patients. Once you have gathered screening responses, Enter the results into the facility's electronic health records or EHR system. Once data is entered, it is shared with any necessary specialist for referrals to be certain all comorbidities are fully addressed. As a healthcare provider, you have the opportunity to encourage your veteran patients to register with the Oklahoma Veterans Registry. Completing this process will be beneficial to the provider and the veteran. The Oklahoma Veterans Registry is used for outreach to inform veterans of benefits, as well as verifying eligibility for certain state benefits. Registration may be completed in several ways, but the quickest way to apply is through the ODVA website shown here. This video has explored the importance of screening all patients for their possible military service. It has walked viewers through the steps to enter, customize, and use that data when providing comprehensive health care to your patients. Here are some additional tips to make your facility veteran-friendly. Treat the whole person. Use VA resources that are available to non-VA healthcare professionals and facilities. Create professional veteran-specific partnerships in your practice. Connect with your community. Veteran family members in the community have specific gaps and needs as well. This is the conclusion of our second video in the RVHAP series. Future modules will include veterans in addiction medicine, veterans in pain management, moral injury, the COVID impact on veterans, and more. We would like to thank you for your dedication to the veteran population by participating in this training module. If you have additional questions, please feel free to reach out to the email shown here.